Good evening. This is Joshua Lewis. This is the health promotion assignment for the fundamentals in health education with Dr. Lester Flower as the professor. The promotion program I've decided to focus on is parent involvement and community outreach, known as PICO. The motto there is by developing our assets, we eliminate barriers. A little bit of a background, this department is one that's in Harupa Unified. There, they educate 19,344 students in preschool through 12th grade. 76% of them are low income, 30% are English learners, and 237 are foster youth. The mission is to strengthen the individual, family, and community by encouraging parents to become advocates for their child's education, providing resources and services that will foster growth of a child's development and school readiness, and connecting community organization to collaborate toward building a healthier, connected community. The goals are to provide training and service and support to parents, build parent leaders in the community, implement the Strengthening Families Network, and also implement the whole child, whole community, and whole school framework. Health promotion methods. There's several. I'll just focus on a few here. First one is social emotional wellness. This is done through case management, where the schools will send out referrals, and then a clinician will come out to the school to support a student with mental health, um, and also provides the families with self sufficiency resources, and also a virtual behavioral health center. They also have a fresh fruit and vegetable program. That is a program that provides fresh fruits and vegetables to schools with 86.5% or higher of its enrollment on free and reduced lunch. They have a 100-mile club that is a running program to motivate youth to run 100 miles in a year to fight inactivity and obesity, which increases readiness to learn, motivation, and student and family engagement. Finally, they have a family clinic at one of our schools. So it's right there within the community, and it provides high quality health care for our local schools and students. Medical services include a family practice, pediatrics, well child exams, vaccines, and women's health and family planning. This program is funded by federal grants, Medi-Cal, and donations and partnerships with other federal and privately funded agencies. The outcomes have been phenomenal. Partnerships with Regal Health provide immunizations and COVID testing and dental services. They've provided over 150 desks for distance learning. Over 300,000 pounds of food have been provided from such as farmers to families and fresh fruit and vegetable programs. They've provided 300 cases of diapers with wipes, clothing, and hygiene to kids, over 200 backpacks, and mental health clinicians to every single site in our district. Here's a quote from Evans. Social determinants of health is a desire for a more holistic approach that gets at the underlying root causes of interventions, reducing more proactive social and health issues. And that's really the theory that's in practice here. We've got the education part, the economic stability, the social context, health and healthcare are being offered, and it's building up the neighborhood, building up the capacity of our parents to be self sufficient. Another quote here is a critical part of the healthcare system is the social work profession that addresses the social and society factors of health and championed advocacy efforts to improve healthcare access and decrease health disparities. This is again in practice. Uh, this department coordinates and advocates with our local U.S. representatives to get more funding and make sure they are aware of the needs in our communities. Some theory based suggestions for improvements include interdisciplinary teams. This would address the individual health and social factors contributing to poor health outcomes. So, for example, you would not only have the medical profession, but also the fresh fruits programs, just collaborating on a team together. Interoperability programs to help manage patient care and transfer information across systems. There will be new and coordinated opportunities in collaborative care. Also, research to evaluate social healthcare. So this is where we use research to identify those limiting and sometimes conflicting findings on uses and outcomes needed. Also need more research in differentiating different patient populations. Also reports, and these reports would educate both the public and the private payers, the healthcare administrators, and leaders. And that's the end of this presentation, and here are the references that were used.